Uh, thanks, thanks for those opening remarks, Taj. And I'd like to just, swiftly take us into the first session. The first session is around collecting, aggregating, analyzing, and sharing zoonotic disease data across animal, human, and environmental sectors. And as we've sort of been emphasizing, there's the operational elements of response, but they're the research-related elements as well. And this two-day workshop is very much focused on those research-related elements. So we're hoping that much of the discussion is framed around the research opportunities and what's and specific sort of technical skills required to create those kinds of collaborations during the response phase of an outbreak. So I'm really pleased to introduce the chair of this session one. We have Dr. John Amuasi, who's going to be chairing this session. And Dr. Amuasi is a senior lecturer at the Kwame Nkrumah University of Science and Technology, KNUST, where he is head of the Global Health Department of the School of Public Health. Dr. Amuasi is also group leader of the Global Health and Infectious Disease Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine. This is the hosts the Secretariat of the African Research Network for Neglected Tropical Diseases, which he spearheads. He's got a long list of publications and accolades, which are way too lengthy for me to go through. But very importantly, Dr. Amuasi also serves as executive committee member of the Africa Coalition for Epidemic Research, Response and Training ALERRT, which is a sister program of Pandora, also funded through the EDCTP. So through ALERRT at KCCR, Dr. Amuasi is coordinating a lot of the research on clinical characterization of COVID-19 in Africa, and is the PI for a number of studies on COVID-19 in Ghana, including some very important phase 3 clinical trials. Dr. Amuasi serves as technical advisor to a number of academic institutions, governments, and global health bodies, including the WHO, Africa, CDC, IPBES, and the World Bank. And he's also co-chair of something we work together on, the Lancet One Health Commission, which is an exciting group of collaborators across the world, very equitably put together, I have to say. And it's been a great experience working with him on that. And so he's on the forefront of global efforts towards addressing emerging and re-emerging infectious diseases. So the perfect chair for this first session. So over to you, John. Thank you for joining us.
Well, thank you very much, Osman, for those really kind words. And it's a great pleasure to be in touch with you all, panelists, speakers, and most importantly, the participants. I think it's really exciting that we can come together to discuss and listen to talks on this important area of collecting, not just collecting, but also putting them together, aggregating them, and being able to make sense of zoonotic disease data, and also making sure that we can share these across both animal, human, and environmental sectors to really take a One Health approach towards collecting and making sense and sharing of data. Now, I'm not going to be the one who's going to get to the meat of the matter. I'll only be steering affairs. And I have the right crew to do this. I have Professor Richard Kock, Professor Danny Asogun, and Professor Wanda Markotter, who are going to be speaking to us. Each will spend 10 minutes presenting on the subject, and then we'll dive into some questions that will come from you, the audience. I encourage you to use the question and answer tab at the bottom of your Zoom screen. I'll remind you once again when we get there and in between the talks. I'd like to start with Professor Richard Kock, who is a veterinary ecologist and infectious disease researcher in wildlife health and disease. And his work has focused on Africa and Asia. He's been working in One Health, specifically that interface between humans, animals, and the environment, and specifically on the impact of food systems in disease emergence and environmental change. He's worked for over 40 years as a professional, and over the last 11 years as a professor of emerging diseases at the Royal Veterinary College in London. He's been awarded several awards, including from the FAO Bronze Medal in 2010, in recognition of his contributions to the monumental eradication of rinderpest virus. He also received the Tom and Beth Williams Award from the Wildlife Disease Association, and so many other awards and accolades that he's received. He lectures in One Health and Wildlife Health and Disease. And we are very honored to have Professor Richard Kock to take the first slot. Professor Nock.
Thanks very much indeed, John. Not wanting to, just to get my name right, it's Richard Kock, K-O-C-K, but don't worry, it's often done. I can't say Robert Koch, but you know, it's fine. It's very common. Okay, so I'm sharing the screen. I hope you can see it. If somebody could just confirm that they.
Could you please put it in full screen mode, bro?
Okay, full screen mode. I think it's in full screen according to.
Yes. No, it's fine.
Yeah. Okay. Perfect. Yeah. Thanks, John. So 10 minutes is not long. So my intention really, I think for any research activities, you've got to understand the context, and you need to have a good framework in order to develop your questions and then apply the activities, and hopefully the outcomes will then take you forward. So that's why I use the term understanding. I think that's really important. And when we talk about zoonosis and we talk about zoonotic origins, it's really important we get this right. And I apologize if some of you think I'm teaching my grandmother to suck eggs, but I think it's really important that we start with this framework. It's very topical at the moment. Of course, we're all aware of that. And there have been a number of reports in relation to COVID-19 in particular, to trying to get to the roots of some of the issues around biodiversity, wildlife, animals generally, environment, and human infectious diseases. So I'll commend you to a number of reports. They don't all agree with each other. And I think that's the important thing about science, is that we must recognize that there are different perspectives, and we need to seek the best evidence. But it is a big question at the moment, and of course it's keeping people awake at night. I think we need to differentiate between two pathways, which I think are very relevant to this discussion and this workshop. One is emerging human pathogens. We know there are about 1,400 human pathogens, and some are new, others disappear, and this cycle of microorganism invasion of the human host is historic. I mean, any living creature goes through these cycles. So that is one pathway. The other is zoonosis. Now, zoonosis is not always an emergent human pathogen. We need to be very clear what we mean. So really, I like the WHO definition. It's naturally transmitted direct infection between humans and animals, but it's mostly used to describe an infection from an animal reservoir host to a human. Okay, so you have to get it from an animal. That's the important point. You can have a reverse zoonosis, and COVID-19 is showing that very clearly, that humans infect animals. Okay, so that is really, I think, a good definition for zoonosis. This doesn't mean that zoonotic origin is the same thing. In other words, you can acquire an infection through a spillover event, or perhaps a one-off event, which can then lead to human emergent pathogens. But that doesn't mean you contract the infection from animals. And again, COVID-19 is a really good example of that. You don't actually get this disease from animals, you get it from humans. And we are very interested in the ultimate origin, but we need to distinguish between those two things. And I think in order to do research and to focus in the right place, we need also to consider proportionality. Zoonosis is rare, even if important. It's not even accounted in any reasonable way within the human global burden of disease. And certainly in the animal field, we don't really have quantified data on burden of disease. And these are the sort of weaknesses we have in the data frame. So again, just expanding a bit on what we call emerging infectious diseases, there was a paper in 2008 which tried to sort of break it down into a bunch of different categories. And, it can include antimicrobial resistance, it can include new host ranges, new geographies, maybe even a new detection method, which then identifies something. And it can mean real new organisms. So it's quite complex, and we mustn't oversimplify this. And to illustrate this, the lower chart shows you human mortality over 100 years from emergent viruses. These are the things we are worried about. But if you look at the actual events, or the cases that are derived, the vast majority are human to human. So when we start looking at research, the wicked problem, if you like, of trying to identify events that are occurring from animals to humans, they're very, very small. So if we want to look at, say, wildlife to human emergent viruses, the window for detection is incredibly small because the majority of cases come from human to human. And this is a really important point. We are dealing with a wicked problem when we're dealing with emergent organisms. Now, when I asked what to talk about in this session, the organizer said, stick to zoonosis. So I'm going to stick to zoonosis and just move on from those emergent pathogens because they are really challenging, and we must be very careful not to think it's easy or straightforward. So the majority of ongoing zoonosis, and this little diagram, if you look on the right, the green is ongoing zoonosis. Okay, so the vast majority of ongoing domestic animals. This is not surprising because these are the animals that we have contact with. And then within the wildlife environment, it's the peridomestic animals, maybe captive, managed, farmed wildlife, would be the one that we have the most contact with. And perhaps traded, perhaps hunted wildlife are the ones that we need to focus on. So it helps us really to hone down on something practical that we can really work with. And when we talk about emerging zoonosis, of course, a lot, or emerging pathogens of humans, a proportion come from wildlife, but actually to detect them is virtually impossible. And there is a common narrative, there's 70% of emerging diseases from wildlife. But actually the truth is only about 43% of all the emergent pathogens of humans come from wildlife. And most of those, I say, just genetic origin, they're not zoonoses. So I just want you to be able to go away with this in your mind so that we can really focus proportionally on what's important. I was a part of a group working on wildlife trade in particular, but also general risks of wildlife. And we did an extensive mapping of the literature and came up with actually quite surprising results. And if you look at this graph on the right, so this was 5,000 publications, essentially everything that we could detect in relation to wildlife zoonosis. In other words, things that are confirmed, where we have actual clinical data and evidence. And we were able to identify 47 publications over 28 years. So that's roughly, just over one event globally a year where we have confirmed wildlife zoonosis. So this, I hope, will illustrate to you how difficult it is actually to detect these things. Even if we all focus on it, the detection rates are so low as to be almost insignificant. And a few years ago, I actually just did a general exercise to look at, actually, when we look at cases, how many are actually coming from wildlife? And I'm going to just show rabies on the left of that graph. This is at a scale which enables you to see, because they're so small, you have to use this sort of scale. Okay, so if we look at rabies from wildlife, it's extremely rare. The United States records maybe 2 cases a year with wildlife origin. The vast majority of rabies cases come from domestic dogs. Okay, so it just illustrates that point. And because we were looking for good examples, rabies is a good example because this is one of the biggest zoonoses, the most frequent event of zoonosis, about 59,000 deaths a year. And the important thing here is that it's preventable. There are good vaccines. So in other words, we understand the epidemiology because it's in poor settings very much. and dogs are often feral. So the solution to rabies is really quite simple. Is really to be able to track events in humans and to be able to identify the case of an animal that transmits that infection. So there's no point in having extensive surveillance systems. You really need to use, for rabies, the integrated bite case management approach. And so that just illustrates in a research framework that there's not one system for all diseases. You have to look at the context and what is relevant there. And just to repeat that if we look at the global biomass of animals, mammals on Earth, 96% are domestic. So you should look there first. Wildlife comes later. And obviously in trade also, the majority of meat. So if we're looking at zoonosis from meat, which is a big source, food sources of zoonosis are very high. The wildlife source is extremely small, but there are huge quantities of meat coming forward. So what can we do about this? Well, I think we can monitor. We can definitely monitor and improve our monitoring, particularly in the food systems. But then we have also other actions that we can take. But this is really, in the research frame, identifying we can spend our investment, land use planning, preventing biodiversity loss, improving health equities globally, for example. One method that's been well tried is the Hassip approach, and this is a hazard identification approach. And I don't need to say too much about this because it's already well established within the OIE and the animal monitoring systems. I would just advocate it as a good approach. This is just an illustration of some of the, there's a wide range of diseases that have been recorded. Nothing particularly stands out, actually. So it's important for you to know that. So take-home messages. Agricultural development and trade is a main issue for zoonosis. So we need to look at that and clarify what we want. Do we want to generally decrease the risk of zoonosis, or do we want to prevent the chance of emergent spillover pathogens, like COVID-19? So we have to sort of prioritize where we want to put our effort. Thank you very much.
Thank you very much, Richard Kock, and apologies for the wrong. I detected it just at the last minute, and I should have really known better, given that we have interfaced at different times before. My apologies, but thank you very much for that really wonderful presentation. We could have spent a lot more time with you on this. So exciting, the subject of zoonosis and really going down into what it means and the differences between the terms and their implications for collecting, aggregating, analyzing, and sharing data. Without spending too much time, I'd like to go on to Professor Danny Asogun. He's a professor of public health, and his interest is in infectious disease epidemiology and social medicine at the Ambrose Ali University, Ekpoma, and Irua Specialist Teaching Hospital in Nigeria. He is the founding director of the Institute of Lassa Fever Research and Control at the Irua Specialist Teaching Hospital. And his passion is to build capacity of younger doctors and scientists in cutting-edge local and international research, which will be highly relevant. He's also the Chief Operations Officer of the Irua Teaching Hospital Research System. Professor Asogun, you have the floor.
Thank you very much, John, and all participants. Let me share my screen. Hope you can see this. Oh, let me see if I can, yeah.
Yes, we can see. Can you put it in full screen, please?
Full screen.
If you could click on the last little tab just before the magnifier. Yes, that very one.
Okay, thank you very much. Yeah, so this is I'm looking at collection and aggregation of and sharing of integrating zoonotic data across human, animal, and environmental sectors has been advertised. This is a disclaimer. All the views expressed here are entirely mine. As Professor Richard has abundantly said, the linkage between humans and animals and environment cannot be difficult to separate. We are quite close. Hence, we have a lot of transmission of diseases from animals jumping into humans. But specifically for this presentation, I'd like to focus on the challenges we are having in integrating data management for One Health use. Also to try to identify some of the requirements to achieve integrated data management. Then I hope to later use the Nigeria integrated data disease surveillance and response system to emphasize the need for intersectoral collaboration for One Health data management. And finally, I will use the Lassa fever control program in our hospital at Irua to showcase the opportunity available for One Health approach in data management and control of zoonotic diseases. So as Richard already said, as Peter has already said, the abundance of zoonotic diseases are all around the environment, and this has been due to a lot of factors like global migration, international trade, and climatic change. And but the goal we want to achieve is that disease surveillance, instead of being vertical as it is now for animal disease, human disease, environment health, we should try to integrate them. To enable us have a further discussion of this topic, I'd like to take us back to the meeting that I held in November 2010 for the Food and Agri Organization of the United Nations, the workshop, which in general terms emphasized that data collection, aggregation, and analysis must be shared, but they must also meet standard quality and ethical standards. However, as we know, zoonotic data have more complex systems of surveillance than other diseases because they are different ecosystem environments, which use different tools for collection, aggregation, analysis are different. So specifically in that meeting, top 10 limiting factors in conducting effective regional and international surveillance for animal and zoonotic diseases were recognized from economists and organizations around the world. Number one, it was agreed that authorities are too focused on their individual mandate instead of thinking collaterally to communicate, cooperate, and collaborate. Secondly, lack of leadership by international and regional bodies on surveillance. And there are some reluctance by many national governments to share data. There's also the lack of understanding by national and subnational decision makers and stakeholders of the importance of surveillance. We also have the failure of sustainability of surveillance in developing countries due to dependence on project funding. There's also a lack of defined vocabulary for surveillance to facilitate data exchange. Lack of epidemiological capacity, including human resources and tools at the national and subnational levels is another factor, followed by difficulties in linking and integrating data from public and animal health agencies. We also have lack of coordination between neighboring countries on surveillance activities. Other limiting factors in conducting effective regional and international surveillance for zoonotic diseases include insufficient funding for surveillance, lack of data standards for reporting, insufficient training in surveillance methodologies, and lack of effective laboratory capability in many countries. Some have, but some don't have enough. So what are we looking for really? In that meeting, it was there was a renewed call for an integrated data management with a focus on, number one, that the data should be integrated across these sectors. Of course, they should be standardized and harmonized so that when one party is using data, we are talking about the same thing. Of course, they should follow ethical principles in research. Such data should be understandable, available for those who need to use them, accessible, and of course, should be translatable to whatever claims that need to be used. Now, looking at the integrated disease surveillance system, there's a great need that national governments, especially in low-income countries, should adequately fund the whole process of collection, aggregation, analysis. There should be increased awareness of the need to have a reliable database globally. Governments should focus on data availability for sharing, communication, and collaborative response. Database management framework countries should exist and they have a leadership for coordination and timely responses. Member states, like you have in West Africa, ECOWAS, and partners should formulate, agree, and implement workable policies on integrated zoonotic disease data management. They also emphasize that governments should invest in zoonotic disease data management across the three sectors of human health, animal, and environmental health for sustainability. Of course, the vocabulary for data management, we need to agree on that to facilitate sharing across the sectors and partners. The system should be user-friendly, and the tools for integrating data from the three health sectors should be developed globally. And arising from this meeting, we will expect that regional bodies like West Africa, as the African CDC is already doing, should have a surveillance and coordination network. Countries' Center of Disease Control in various countries should develop and implement a uniform standard for operating procedures for zoonotic diseases reporting across these sectors. Capacity to use standardized methods of data management should be built across sectors and countries. Of course, where possible, we advocate that developing economies should be helped to develop infrastructure, human resources, and networks to support One Health. We are encouraging early and middle career scientists interested in One Health. Such persons should be identified and trained to lead in surveillance activities, including trainings. Now, I'd like to quickly focus on Nigeria, what has happened. Looking at the NCDC, Nigeria Center for Disease Control, a plan for 5-year strategic response to conceptualize One Health has started. And this plan is a clear paradigm shift from the central surveillance system by the Ministry of Health. Now there's a gradual integration of data management across the three sectors, human, animal, and environment. Human integrated disease surveillance approach in Nigeria has been responsibility of the three ministries. Ministry of Health, doing that via the National CDC, and also the Ministry of Agriculture and Rural Development via the National Animal Disease Information and Surveillance and the Animal Resource Information System. The Ministry of Environment is already developing theirs to complete that. Now, this is the One Health plan as it was developed. Now, this has undergone some form of implementation towards the approaching, actualizing the dream. The animal sector, from wildlife, community leaders, veterinary officers, epidemiologists, state directors of disease controls, various levels are involved. Of course, the reference laboratories are part of it and part of the environment also. Now to also look at what we have tried to do at IRUA, where we had the Institute
Could
of
you
West
kindly
Africa.
wrap up in just about a minute, please, because of the time constraint? Thank you.
Yes. Yeah. So I will round up by looking at what has happened at IRUA, where the capacity for One Health has been put together by this group of young doctors and scientists that you can see in this picture. So they have gone to the field and collected data from mastomas and from humans. And they have shown human cases and mastomas distribution in the various communities they've been to using GIS. Of course, there are many challenges to this due to lack of funds, and the ability of the surveillance system. We are hoping that based on what they have started, we'll be able to move further in building a One Health system. Of course, from what they have done, papers have been published and presented at conferences in India and various parts of the world. So to conclude, I would say data as a fundamental tool in health research for preparedness and response to zoonotic disease outbreaks must be carefully collected, aggregated, shared, and integrated across the human, animal, and environmental sectors. For the data to be meaningful and useful, it should be harmonized, standardized, made accessible, understandable, easy to use, and available to all who need to know or have them, especially those in the human, animal, and environmental health. I want to say thank you. I want to thank Dr. Ike and some people in IRUA who are members of the One Health. For organizer of this workshop, I want to say thank you. Some biography. Thank you for listening. Over. Thank you, John.
Thank you very much, Danny, and sorry to have rushed you. It's only a constraint with time, with eating into our Q&A time, but the good thing is that we have the Q&A tab and it's open. I can already see questions coming through. Some have been answered already. So do check the Q&A tab and field your questions right there. Let's go on now to Professor Wanda Markotter. Professor Markotter is the director of the Center for Viral Zoonosis, Faculty of Health Sciences at the University of Pretoria. She occupies 2 research chairs. The first one is the DSI NRF, South African Research Chair in Infectious Diseases of Animals, that's Zoonosis, and chair in People, Health and Places at the Future Africa Institute. Her interdisciplinary research program focuses on bat pathogens and the risk of spillover in Africa. So I think it's a beautiful segue into the 2 previous presentations. And most importantly, she was appointed in 2021 as the co-chair of the One Health High-Level Expert Panel, otherwise known as ALERRT, which advises WHO, the OIE, the FAO, and UNEP, otherwise known as the Tripartite +1. Professor Markotter, floor is yours.
Thank you, John, for the nice introduction. And it's now the quadripartite. It happened about a week ago. So that is actually a big step forward. UNEP is also now part of the partnership. Just a comment on that. But thank you for the opportunity to present today. And I'm just going to show 3 slides and try to illustrate a few points based on these slides. And I think I might make the comment at the beginning that it's also about research priorities. And I think we're looking at research gaps, but we're also looking at how we can structure surveillance and getting data on diseases going forward through our routine surveillance. So it's a bit of both that I'm going to present today. And it's really very much focused on collecting and analyzing and sharing data in terms of diseases. So the slides that you're seeing now is very familiar slides. We've been using them all in our presentations. But if we look at zoonotic diseases, and specifically if you look at the graphs on the one side, there's different points in the landscape of zoonotic diseases that we need to consider if we talk about collecting samples and data. And one is some of the areas that was previously also referred to by Dr. Kock. You know, there's these pathogens in nature They've always been there. They can be in wildlife reservoirs, they can be in domestic animals, they can be in vectors like mosquitoes, and they've been there forever. And at some point they spill over because of specific reasons. And if we target our surveillance there in what we call the reservoirs, it's quite complicated. Richard also mentioned, there's just to find this virus or to find this pathogen in this high diversity of wildlife host species, or even domestic animals in a huge global landscape is difficult. On the other hand, what makes this difficult is you don't see disease in these reservoirs. So it's not like you're seeing a sick animal that you can go and test. So it's a completely different way of looking at surveillance if you're looking at this group. And it's also very low titer usually of the pathogen if we're looking at bat species, for instance. So there's all kinds of complications in how you design your surveillance strategies, depending on where you target it in this landscape. Yes, it's great for prevention if we can target it on this and we know exactly where the next virus is going to come from, but it's not so straightforward. Then there's the spillover where some of these pathogens will spill over to other animals, or it can even sometimes spill over directly to humans. And mostly here you would see disease, so it's sometimes easier to recognize. And we can target animals and humans in this interface, or what we usually see is when it starts spreading in the human population, and that's when we detect it. But that is obviously too late, and it leads to lots of other consequences, as we've seen with COVID. But just to indicate that we need to consider these different questions when we talk about collecting samples, collecting data, analyzing data. The other thing that I want to point out in this, so we always look at these figures if we talk about one-health surveillance or doing surveillance using one-health approaches. But there's a very important thing that we seem to not have integrated into these approaches in the past. And that is where this spillover happens. So I want to go to my next slide. There's reasons why pathogens spill over. There's contact. And there's contact between these reservoir animal species and humans. And there's reasons for that. And we forget that if we look at the whole picture of collecting data and samples. So this is just from previous studies. There's several reasons, and it may be completely different in different areas of the world. And it changed. Part of it is human behavior. Part of it is climate and weather, breakdown in public health systems. There's so many reasons, some ecological reasons like land use changes. Was previously mentioned, the wildlife trade, illegal or legal, animal markets. There's so many reasons, but we're not bringing this into the picture if we're talking about collecting data and collecting samples. And this is actually essential if we're trying to go to a phase where we want to do real predictions. So to get back to One Health, and that is my next slide. And this is the One Health definition as released by ALERRT a while ago and endorsed by the 4 partners. We really need to look at this full picture if we're also talking about collecting and analyzing data in the One Health, using a One Health approach, where the ecosystem, healthy animals and humans are equally important. And the other part of this diagram that we brought in is how important society is. So if we really talk about data collection, collecting samples, we also really need to look how society fits into this picture. And then we've got the 4 C's that we all know quite well that fits into One Health that we always need to take into consideration. So based on this, just maybe a few perspectives from my side. So traditional surveillance is really organized in silos. And I think that is one of our major issues, and we're all dealing with it. And it's not so easy to necessarily change that. What did I do now? I made my slides bigger, sorry. And we really need to look at implementing a One Health surveillance system. And what does it mean? It doesn't just mean collecting animal and human samples. It means including some of the data that I've also mentioned. And sometimes we have some climate data, we have some weather data, we have some land use change data, but it's lying somewhere else. We're not overlaying that with our disease data. And it's important to get that data. Sometimes we don't have the data and we need to actually collect it for some of these important drivers of potential spillover. it's complex. It's definitely not easy. And I don't think we have all the answers yet on how this must look. But it is certainly something that we need to consider going forward if we really truly want to implement One Health surveillance systems. There's several barriers in terms of professional barriers. Budgets are a huge issue. It's still siloed. Decision-making, data sharing will always be an issue. We need to find ways of sharing data more efficiently. There's capacity issues. There's governance issues that needs to be sorted out. Technology issues in some cases. But we really need to move forward in terms of what we collect, but then also what we need to do with that data and how we're going to share it. So one of the terms we've also been using is there also need to be one data. If we're talking about One Health, we also need to talk about one data, and we need to find a way to share things in real time. And I think the last point that I want to make is the role of communities. We shouldn't underestimate. You know, we talk about citizen science or community surveillance. They are the people at the front lines that can tell us about human behavior changing. They can tell us an animal is sick, and we haven't been capitalizing on that, I think, in the past. And it's really something that we need to see how we can incorporate it in the future. Thank you, John. That's all from my side.
Well, thank you so much, Professor Markotter, for the presentation. I think all three really fit nicely into each other and address this issue of collecting, aggregating, analyzing, and sharing data. But there are a good number of questions. We just have a few minutes, barely 9 minutes for the Q&A. And so I'll take advantage of that to read some of the Q&A, the questions that we have in the panel. There's one that I think is a thread running through. I'll read it first from Lois Olajide, who says, there are different surveillance platforms for human, animal, environment structures. There is a need to ensure there is interoperability between the systems as to guide One Health activities. And the leader Inkum also says, bonjour et merci, la brillante présentation. Comment faire pour capter les données dans les deux systèmes animaux et humains quand les deux ont des systèmes différents ou quand le système n'est pas fonctionnel? So essentially, sorry, I think I just messed up the translation system there. My apologies. But I just wanted to show how, you know, people asking the same kind of question, which is really having different systems and interoperability. I'd like to pass this on to you, Richard. Did you have a first take on this?
Hi, John. I've been trying to answer some of the questions, John. So what specifically do you want me to address on this?
So this is about the concerns about interoperability between the human animal.
Look, I think you know, it comes down to sectoralization. You know, I'm a vet by training, but I've had the privilege to work across sectors. But there's no doubt that there's a certain degree of suspicion between different disciplines. You know, we are trained often independently of each other. We don't learn how to speak to each other. And this, you know, within the medical frame and the veterinary medical frame, we at least can communicate. But if we're looking at many One Health issues, like environment, for example, or ecology, this sort of thing, we don't really speak the same language. So in order to get that interoperability, we have to get people around the table. We have to begin to learn to talk to each other and to understand each other, I feel. Once we begin to do that, then we respect each other and we begin to then take actions which are not so narrow. And I think to solve many of these problems, that's what we have to do, actually, to get better understanding and find novel solutions, innovative approaches beyond vaccination and all that sort of thing. Thank you.
Well, thank you very much, Richard. I'd like to ask you, Wanda, also just to address this issue of interoperability, which is so critical.
I think I agree 100% with Richard. You know, we first need to get everybody around the same table to start talking. And that's usually the first point, and that usually leads to more action. And I think in some of the countries in Africa, there's been a nice summary, I think, on the ILRI website, you know, on national One Health plans, where they're starting to at least bring the three ministries together and they've got different names in different countries. But you know, plans like that also help, although we're still siloed and we're in our different ministries, at least you have some mechanism to try and bring different people around the table to start talking about a One Health plan, including the environmental issues. And it starts with that. And I think one of the things, because we get asked this question a lot through OLAP, you know, how do you implement these things? Is that you don't have to start big. You just start with a small project and you do what you can, and you won't be able to do everything right from the beginning. But it's a start, and from that you get momentum, and it usually becomes a better collaboration. So that will be my take on it.
Now, many thanks, Wanda. I think both your response and that of Richard bring to the fore this whole idea of what One Health, the systems thinking, just that approach to understanding what the implications for one or the other would mean, just making sense of the data. I'd like to go on to you, Danny, and there's a question on if you could shed more light on the GIS project, and particularly if you could touch on how the information flows from health facilities with Lassa cases to the national coordinating body as the NCDC, how this information really informs some of the One Health interventions that have been undertaken.
Yeah, thank you very much, John. As I said during the presentation, right at Irua, we are in the heart of the Lassa fever endemic zone. Some 2013, a group of lab scientists, doctors, and some person in the university came together, and then they went to the field, and using the ArcGIS, collected human data from households where the Lassa fever was occurring, and then also went to the very domestic bushes around them, caught some mastomies, then look at them, and then they were able to, those maps I was showing, they plotted those maps showing the human cases and the distribution of mastomies. So that's how using GIS, they were able to come up with hotspots for Lassa fever in endemic communities in those states, which has been useful in the surveillance for Lassa fever and the control. As for the pathway for the flow of information, what normally happens in each local government area in Nigeria, there is a disease surveillance and notification officer who comes to the hospital to collect data for Lassa fever and other diseases, of course. And it passes it on to the State Ministry of Health, specifically the Department of Health Statistics. And from there it moves to the Federal Ministry of Health and then to the NCDC. So that has been the pathway for yeah, thank you.
Right, and thank you very much, Danny. I think we just have maybe 2 more minutes, and I will like to take advantage of that to ask one of the questions from Ayu Devi, who asks, what's the research differences between research, or what's the difference between research to decrease risk of zoonosis and then the research to prevent spillover? Danny, do you want to just go at this really briefly in a few seconds? The difference between research to decrease risk of zoonosis and then research to prevent spillovers. I think Richard spoke to this a bit in his presentation, but Danny, if you could just comment on this. And then what kind of data we need for this?
Yeah, definitely. We all need to, as I've emphasized, we need to be careful in bringing everyone together under one head to look at this data, whether from the animal sector or human and environment. Like what has happened in if I may give an example with what's happening now in Edo State in the control of Lassa fever. Data that comes from research have been available for use. Efforts have been made to come to bring the environmental people to the table, and also bring people from animal health back on the table to discuss together what research data that have been available. Yeah.
Thank you. Yeah, no, thank you very much, Danny. Wanda, could you also just address this issue of research for spillovers versus just the existing zoonosis?
Yeah, so I think I don't understand the question 100%, so I hope I'm going to answer it correctly. But I think looking at risk and prevention for me is in the same category. I mean, a risk, you're trying to determine if there's going to be a risk, to try and put in mitigation actions so that there's not going to be a spillover, where prevention is sort of in that same category. I don't know if Richard will agree with me, but he can also comment. And then there's really the response part, which we're dealing with now in COVID, but we're not even dealing with a zoonotic disease in COVID anymore. We're responding on a human disease. So the prevention is really in that first part of the graph that I showed, where you're trying to prevent that spillover from happening in the first place, or detecting it really, really early before it spread too widely, in my opinion. I don't know if Richard wants to comment on that.
Yeah, look, I'm going to add, I think one of the big problems we've got in this area, particularly of spillover, is data. We lack data. So you see, I mean, there's lots of generalization, lots of narrative out there. We know that deforestation, agriculture, large populations of animals in contact with humans and so on, comes with risk. We sort of know that. But, are we going to stop humanity developing? Are we going to stop people, doing what they do? Maybe. But maybe we'll have to, at some point. But it's all about getting the data. So I'm afraid we're in a very weak position, I think, within this framework. And I tell you, it's because zoonosis and emerging pathogens fall between stools, because it's sometimes animal, human. In other words, it's because there's been nobody really looking at it, and the data's not there. So I think the first job is let's get the evidence. So everybody needs to work more in this field. Whether it be with wildlife, whether it be with domestic animals, whether it be with humans, at this interface. That's what it's about. Thank you.
No, Richard, thank you. I just want to take 30 more seconds. I want to ask this really burning question. The whole issue of data, and we need more data, yes. The cost of collecting data is astronomical, and it's sometimes even invasive to collect all this data, versus the risk of a spillover. Is it really worth it? And how best can we do this efficiently?
In a vacuum, I think the problem yes, we could use precautionary principle. As I said to you, we could ban all wildlife trade, for example. It's been requested. We could ban all domestic animal food sources. A lot of people think vegetarianism is better. We could take those paths, John, but will society accept that? I doubt it. I think they're willing to take risk, actually. So I think we do need to get the data so we can identify what actually are the risky actions. And I think there are some actually pretty obvious risky actions which we could address without actually destroying the whole system. So yeah, very difficult. Thanks.
Indeed. No, thank you very much, Danny, Wanda, and Richard, for your wonderful submissions, presentations. Thank you for the questions that came. We'll still try to answer, panelists will try to answer some of them on the Q&A tab. So do look out for those responses. I'd like to say thank you once again. I hand over back to you, Osman.